So what are some of the data points that you're currently using for your behavioral health services? What type of data are you collecting? How are you collecting?
I have some students on SRBI, and they have behavior charts, and our school psychologist is the one who compiles all the data, but we have charts that help them track their behavior.
So is it electronic or is it paper, folders?
I fill out paper.
Paper? Beautiful progress monitoring charts. Good, good. Others? Okay, so this will be very beneficial for you because there's been some outcomes from the data committee that will give you some really good resources and tools. So it sounds like maybe the quantity of your behavioral data is slightly different from your academic data, right? Not as much, not as fruitful. Can we talk about the subjectivity of that and maybe how that might influence some of our decisions? So we don't have raw data, right? We don't have actual physical data. How are some of those decisions being made when we are talking about an intervention plan for either academics or behavior?
The behavior is reactionary. Certainly, they look at data much more for math or reading and how the students are achieving, but behaviorally, it's much more reactive.
Thank you for your honesty. Good. So our ability to be in a more preventive mode and really looking at some trends and patterns in our data for our schools, which leads to our third question, right? And so how are we organizing our resources into a continuum of supports for all learners? But particularly, how are we recognizing that maybe some of the supports that we have in our school aren't to the degree or the intensity or clinical enough to support the mental health needs of the students that we serve? Yes? Okay. So I'll transfer now this to John, who will talk a little bit about the history of the project, the districts that were involved, and the outcomes of the data committee.
Okay, so the Safe Schools Healthy Students project, I figured I'd just go through a little bit of history, but instead of me just telling you, I said, well, why don't I just ask a few true and false questions, and you can tell me if they're true or false, right? So here's the first slide. We've got 2 questions here. So first one, since 1999, the U.S. Departments of Health and Human Services, Education, and Justice have collaborated on the Safe Schools Healthy Students initiative. Do we think that's true or false? Somebody says true. I heard true. Yeah? You're right. It's true. That's a true statement. When we got funded here in Connecticut in 2013, they made some changes to the program, which we'll talk about a little bit later. But that statement is actually true, and it's a collaborative effort of those 3 federal departments, and they all contribute money to the project. How about that? They actually collaborate and give money to the same project. Safe Schools Healthy Students, besides, it's very comprehensive and incorporates these 5 elements from early childhood, youth violence, substance abuse, youth, connecting families, and of course the mental health issues. Is that true? I see head shaking, yes. If you're listening to the executive director of CERC this morning, she mentioned those 5 elements. Yes, it is true. So it's a really large scope project. It's very comprehensive in the kinds of things that we're looking at. Safe Schools Healthy Students, that's the acronym there, SSHS, funding came to the Connecticut Department of Mental Health and Addiction Services, who implemented the project with 3 school districts. True or false? What do you think? You see some people saying true. It's false. Because the Connecticut Department of Mental Health and Addiction Services didn't do it alone. It's a collaborative project, right? They got the funding, that part is true, but they were required by the feds to collaborate with the State Department of Education, right? And our justice system here in Connecticut. And not only that, but we involved several other state departments, including the Department of Public Health, Connecticut Department of Children and Families, We had early childhood folks involved as well. So very collaborative project here in Connecticut as well as at the federal level, even more so here at the state level. So Connecticut over 4 years plus a no-cost extension period received over $8.5 million with this project. What do you think? True or false? True? Yeah, it's true. That's how much money was received. A lot of that money went out to those 3 school districts: Bridgeport, New Britain, and Middletown. Those are the 3 school districts involved, really involved as learning labs for us. We're obviously going to talk a lot more about that as we move forward. But yeah, so it was quite a big pot of money over the course of the last 4 years plus a no-cost extension. All right. The Connecticut Department of Public Health convened a Data Innovation Committee as part of the Safe Schools Healthy Initiative to help school districts better utilize student behavioral health data. True or false? What do you think? Do you think in a highly collaborative project like this that DPH would do that all by themselves? No, they wouldn't. The last half of that statement is true, but the first half is DPH and State Department of Education co-chaired the Data Innovation Committee and include some really important members from the school districts that were funded and also from school-based health centers and other really important partners. So it was again, a very collaborative effort. True or false? Is there a national cross-site evaluation that since 1999 has really shown Safe Schools Healthy Students has been very effective in bringing people together to better serve and, again, improve student outcomes, really? Yeah, that one's true. That one is true. Yeah. So we know this is an effective program due to the the national cross-site evaluation. And I'm really anxious to see the evaluations from this cohort, which again aren't out yet, because I think we've actually upped the ante. I think we've made some really incredible progress here. So I'm really excited about what we've done in Connecticut. Okay, so what have we done in Connecticut? I'm specifically going to keep my focus here, or our focus here, to what the Data Innovation Committee has done. And so what we really determined is that, okay, so as those 3 essential questions that we started with, we really aren't collecting the kind of data that we need to be making good behavioral health service decisions to improve student outcomes in that area. We've been doing this now for academics for a long time, but we haven't been doing it on the behavioral health side. And what the data committee was the purpose of the data committee was to say, well, you know what? We need to collect better data in order to improve student outcomes on the behavioral health side, not just the academic side. And really where that starts is getting families, getting parents involved. If I'm going to collect data and use data, right, I need good family support. I need parent permission. So there's this universal consent for release of information up on the website that's associated with this conference. All of the products and the tools that we're going to talk about are up on this website, and so that you can go and download and use them, individualize them to make them work for your school district kind of thing. So, but really what this is about is it's about building that trust. This is really critical. One of the points that the Data Innovation Committee really came up with is this idea of we've got community partners, we've got schools, and we've got parents. And there's this triad of partners that really need to come together to improve student outcomes. And so if I'm one of these non-trusting parents, I'm not signing your consent form. That's all there is to it. And so how do you gain my trust? What are the things that you need to do for me to gain my trust so that I'm going to be a partner in improving my kid's situation, what my kid is able to do both behaviorally and academically in school? And so obviously it's not a one-size-fits-all situation because what my needs are different from any other parent's needs might be, right? And how do we help parents and how do we build a trust? It's this idea of we are about improving student outcomes, and you can trust how we're going to use this data in terms of helping your kid, not for some other nefarious reason, which is what the concern of parents are. So it starts with this. It's a really simple form, but it starts there. The next step, once we've got a consented release of information form, the Data Innovation Committee said, okay, now what we need is we need a way that schools and communities can start partnering together, right? And so we created this template for a memorandum of understanding for how this service collaboration might work. I don't have the resources in my school to provide all of the behavioral health for all the behavioral health needs of my students. But guess what? Those services exist out in the community, or at least somewhat in many communities. And a lot of communities, they're there. One of the things that's happened with some of our school districts is that they've gotten these community partners to get into a third-party insurance billing process, so there's no cost to the school districts at all, right? So there's ways that community partners can do this, that schools have a much harder time doing this. And so, again, it's about bringing those school partners into the school, but doing it in a format so that we know what the terms of the agreement are. I know what the terms, what is this community provider going to be doing? What is the school going to be doing? How do we bring them together to provide these better services? So this is a template form that we have worked through a lot of the FERPA issues, those kinds of things, so that you can take it and, again, adjust it to whatever your school district needs might be. So you can increase your focus on academic success issues with these students. So now we've got this release of it. We've got this partnership with parents and community providers, this MOU to help us figure out what the terms of this partnership with our community partners are. Now we've actually got to collect some data. So what's the data that we're collecting? So we have this student supports form, student support data collection form. This is, again, a sample form. It's up on the website. You can take it back to your district, use it however you want. In Bridgeport, and Nekita's going to talk about this in just a minute or so, they created this as a Power School module. So this data is being collected and being used there to identify student needs, right? Patterns of student patterns of student issues that are going on, so that it allows lots of different kinds of data being collected. And so now, once we have this data, and if we're sharing this data with our community partners, imagine that. We could be sharing this data with some of our community partners so that they could be helping us provide the services. They've got the information about what's going on in schools. Maybe even they're entering some of this information so that we know what's going on in their treatment services, so that, and again, not everybody, this is not available to everybody, which is, Nekita's going to talk about that, but that then with that data sharing information, we can, again, improve student outcomes through this process. The one last thing that I will mention, one product that is not up on the website yet because we haven't quite finished it yet, the data committee is working on a set of guidelines or protocols for how to use this, including where does the parent fit into this, and what kind of, where do they get access to this, and how do they get access to this kind of information. So there's a lot of thought going into that. It's in draft form right now. It will get finalized maybe at the end of June or into July, but at some point in time it'll get finalized and also go up onto the website. So it kind of gives some direction on how to use this form. Any comments or questions before I turn this over to Nekita?
Maybe I can get the pointer to work this time. Good afternoon, everyone. My name is Nekita Carroll Hall, and I am from Bridgeport Public Schools. I am a social worker on special assignment 4 years ago, I was brought on to tackle this wonderful grant called Safe Schools, Healthy Students. And so what I'm going to present today is really how Bridgeport took this grant and really began some really important prevention work for our district. So I think John went over the 5 components. So this grant was huge. I mean, we had early childhood, mental health, substance abuse. The point is, everything under the sun, we could have done a grant just on one of the components. And so one of the things that Bridgeport really wanted to hone in on is really improving mental health and student support services in Bridgeport. We have over 22,000 students in Bridgeport. We have 37 schools. It's a huge district. A lot of our students come in with multiple needs. A lot of our students live in poverty. A lot of our students are trauma exposed. So mental health is very significant in Bridgeport. And so what we really wanted to do is support our support staff with improving their practice. So we came up with a student support page. So one of the major charges of the grant was to develop a data collection for mental health visits. So that term, mental health visits, when that came up, it really kind of threw everyone. First of all, people were like, mental health in school. Some people felt very uncomfortable with the idea that we were collecting mental health. So we started to frame our work around student support, because really that's what we were doing. How do we work with students when they're coming in, they're having difficulties, they're dysregulated? What kind of support do we provide? And so we developed a page which was a very, I would say, an inclusive process, a very inclusive process, because in our district, we have very big schools. And a lot of times social workers are doing their thing, and school counselors are doing their thing, and school psych is doing their thing, and not everybody is working together. And so when we developed this page, we felt that it was very important for, number one, is to be a multidisciplinary approach. We invited all of our support staff, like representers from each discipline. We invited parents in these groups. We also invited administrators and our community partners to really sit down and think about what were the things that we wanted to capture on this page and what would be helpful. So the bottom line of it is that we wanted a transparent process. We wanted to create a tool that if Susie Jones, and I always give the name Susie Jones because we always say little Johnny or little Billy. Well, in Bridgeport, her name is Susie Jones. So Susie Jones, if Susie Jones is on the east end of Bridgeport, and so she becomes homeless and she moves to the north end, she's got a slew of things that were going on the east end. So we wanted to give our district a way of being able to, number one, see what the needs of that student are, and also to see what the things that were done in terms of referrals and who was working with her. A lot of times in our work, we have students who have multiple needs and they're being serviced by different providers, and we don't always know what's going on for that student. So this was another way to create some continuity of care so that if there is that transient issue, which is huge in Bridgeport, that this file will travel with this child and that group or that team will not be starting from ground zero again. Okay? So I caught it all. Okay. So when we looked at the student support page, I don't know if in your districts you guys have log entries. Anybody have log entries? Basically, it's for discipline. And so if you've ever read any of those log entries, I mean, the things that are written in that log entry, if a parent was to see all the descriptive and how people like speak about children and just like the narratives, it's just not okay. And so we kind of looked at that as a model, and we decided that, number one, we didn't want to get into that, especially when it relates to mental health. We don't want those long narratives. It's not a a clinician's note. It's really to have basic information on what services did the student come in for, what service did you provide, if the child was referred, where you referred to, and what the date was. So we can track referrals and also services in the school. Also, one of the things, and so we did that as in a form of a drop-down menu. So the provider can actually check off the service. So, you know what's going on. The other thing that we wanted to look at is the time widget. So what we saw is that in a building, if you have 1,100 students, some of our students are very creative in getting their needs met. And so they do that whole thing called, right, frequent flyers. And so they hop from the front of the building to the middle wing to the end. By 11 o'clock, they've made their rounds, right? And so we wanted to also look at, because this tool can be used in real time. So if student A comes in at 11:07, if they move at 11:15, it goes right in the log, so you know where they've been, okay? Kind of like an office visit when you go in your office, okay? And also we wanted to look at, in terms of looking at trend data, is a student, are students coming at a particular time of day? Are they coming in the morning? Are they coming after lunch? Are they coming right at dismissal? You know, what are the trends for that particular student? Okay, yeah, and referrals. So this is what it looks like. So you have, let's see if I can get the pointer to work today. Yes. So we have the date of the visit, the staff visited, and so in that particular section, we actually, it was important for us to see the name, you know, because you want to know who was doing the service, right? So not just generically, social worker. The purpose of the visit. So in this area, there is, that's one of our drop-down menus. Okay, and then we do, because I like to collect data on the disciplines that are using the page, and we do have limited access to who can see this page because it is mental health data. Our building administrator, because we kind of went back and forth, should building administrators have this? Of course they should. They run the building. They should know what's going on with their students. The school nurse, the school social worker, school counselor, and school psych. So these are the only folks that will have that information related to the student. The other thing is the time widget that I talked about. And then after you log in your information, and there is a very limited access to notes can be taken, but we have character limits. So you can't get into that whole narrative. You submit the log and then it tracks it. So you have a log of what's going on with that student. Excuse me? The staff does. And so ideally, again, this would happen if you got a referral or someone sent the child to your office. And this is also for general ed students. This is not for special ed students because we already have a system for collecting data for special ed students. Many of them are in IAP Direct. So we have that mechanism. This is for general ed students so that we can stop that timeline of referring kids to special ed so they get services. This is so that we do our interventions before they get to special ed, and we also track those interventions. So really, it's really prevention. So we started our first pilot. Again, reminding you, Bridgeport is huge. We have 37 schools, so we didn't start in 37 schools. We started in 7 schools. We started in our first year, and we saw some good use. But over the last 3 years, it's grown. It's grown huge. I made a joke. Are there any social workers in the room? No social workers? All right, social workers. Any school counselors in the room? Okay, so I can say this. Okay, so, there's a lot of competition between school counselors and school social workers. So school counselors are beating us, and it's okay because everybody's using the page. So we're really excited about that. So in our first year of implementation, we had 222 students who received a student support visit. To date, we have over 1,000 logged entries for students. So it's huge. I mean, it really is significant for what we do. And I asked the question in the first session, why do you think we saw an increase? Because we were tracking it. Yep. Why else do you think we saw an increase? Yes. Our users saw value in it. Absolutely. Anecdotally, what I heard is that really this became a way of practice in a building, that without it, people were just feeling like, oh my goodness, our page crashed one day. And like, I got so many emails like, this is how we track our kids. This is how I know who's seeing who. This is how we do business. And so it really became a part of practice. Another reason that I think that we saw such an increase in the usage is that this came from frontline. It wasn't an intervention that was put on top of you. This came from the people who do the work. And so they saw value, as one of our folks in the audience said. One of the things I want to note, and it came up in our first session, is documentation of referrals and access to service. When I did a view of the data and really looking at, the different components and how we did in terms of data collection, one of the things that I saw is that really we didn't collect referrals and access to service. So I don't know why. I know that there were lots of services that were provided. What I speculate is that providers are very busy in the work. So once they see the student, they're on to the next. And so there was some discussion about what we could do. And so I'm going to go back to my team because we were problem solving very actively. And so Power School does have a way that you can do an alert. So once a provider checks the box that they have made that referral, that then it cues them to just document that information, whether the student did access service or not.
Jump in for a second.
Yeah.
One of the issues on the national level with the Safe Schools, Healthy Students Project, one of the things that the feds really identified was the fact that when schools are making referrals, especially to community providers outside the school district, that there's no communication back. So we never know what happens to those referrals. Do the students actually get seen? Do they get a service provided? Is there any outcomes related to that? We don't know any of that information. This is across the country. So this was one of the things that the feds really wanted to see happen with this later cohort of the Safe Schools Healthy Students Project. And while it's not perfect, we're making progress.
We are making progress. Okay. Were there any questions related to the student support page at this point? Yes. Okay, no, that's fine. So this is not accessible to parents. Parents cannot view it. Of course, if a parent requests to see what's on the log, they are entitled to see. What we have done, we did include parents in it. And one of the things that parents said, if my child would have had this before, I feel like maybe things would have happened differently, because they saw the value of, because a lot of times we feel like, oh no, parents are not, they're going to be averse to this and they don't want this information. Parents want their children to succeed. And so anything that's going to really help their children to succeed, especially as it relates to mental health, because that's what we're collecting. We're collecting information about children's mental health. These are the kids who are coming in who are cutting. These are the kids who are coming in suicidal. These are the kids who are coming in and they're tearing up the building. And so we're just doing our best to really try to support those students. And so what we've heard from our parents is that they were very positive toward this data collection piece happening, because that would mean that services could be rendered sooner rather than later. So yes. So typically, if it's something where a parent may need to be called because it's a 211, if it's the child was very dysregulated, we're calling the parent anyway. So that's just part of what, part of when you say service provided, make contact with the parent and you make a little note. Most times, anytime I saw a child that wasn't my child, meaning on my caseload, there was a parent call, because number one, that's just out of respect, that if you're a clinician and you're seeing someone's child, you make a contact call and let them know what's going on. So, I mean, that's best practice. Can I say it happens all the time? No.
Okay. So I think Jeremy was hitting upon how we might use this data, right? And so it's not only for our individual service planning for a student within a day, within a week, within a month, but it's how we're actually organizing our continuum of supports for all students. So when we're recognizing that we're having a majority of students exhibiting certain behaviors, what do we need to do differently at core? What type of supports do we need to reach out to our community for, to our region for, in order to not push everything to be a crisis support or a 211, right? So this is really important that we think about the data collection, not only for the individual intervention supports, but also how we organize our systems of support across the school. So we look at some of the different applications that we'd like you to think about as a result of the conversations today, is looking at these three things. How might your school or district benefit from the data tools that John shared? So you'll see how Bridgeport actually took that consent for release of information, took that memorandum of understanding, and now has a very secure system that is evolving in regards to its implementation, but now actually has that student data collection piece right built into PowerSchool. So you can certainly call upon Bridgeport, call upon Nekita, and actually access those fields in that mainframe so that you could bring that right to your district technician to create those fields. It's already been developed. So if you're a PowerSchool user, you don't need to necessarily recreate. That may be of interest to you. The second thing is, what are your patterns in student need, and how might those be fulfilled either by your homeschool community health centers, your regional centers, your state service centers, and how do you know what resources are available within your region? This is something that John and I have been talking a lot about. We know there's things on the State Department website in regards to who you can access regionally, but do you know specifically which resources for which types of behavior and which types of students and families? And so that's something that if we could expand upon that directory or help direct you or guide you in different ways, that's some conversation we'd like to have. And then finally, thinking about how do we develop low-cost, no-cost partnerships that are more preventative in nature. So you're using that data to say, okay, my district, my town is struggling with substance abuse, struggling with students who are in states of depression and really moving to a more suicide attempts. And so what are we going to do with our community services, with our faith-based organizations, with our civic organizations to create a coalition? So this is really a movement, a culture within our community, and not just something within my individual school building. So John will expand a little bit upon number 3, but do any of you have currently in your districts or in your communities coalitions that have been formed? Yes, okay. What district are you from? Okay. Meriden Wallingford Community Collaborative. Excellent. And so how we organize across those two communities. Excellent. Others? The one that you see here, which might be a slightly different in regards to a type of district, a very large district, 8 elementary schools, 2 middles, 1 high school of 2,100 kids or so, or one of the larger high schools in the state, have organized what's called the Southington Townwide Effort to Promote Success. And so it started originally grant funded, continues to be receiving grant funds reciprocally each year because of the great approaches and the benefits that they have had within the district. Not only are there things that they are doing town-wide or community-wide to build developmental assets, so it's based on Search Institute's 40 developmental assets if you're interested in that. But they're actually taking surveys biannually so that they're actually tracking cohorts of students moving from elementary to middle to high school so they could see how some of those trends are changing over time. but then they've actually also forged student councils where they are supporting teachers in developing what they call asset building classrooms. And so each of those assets, as they are being developed and as they are recognizing that maybe some need to be more strengthened than others, they're actually building those into some of the professional development, into some of the days within each of the elementary, middle, and high schools that are really student-led, which is a very exciting approach. So, John, I don't know if you want to expand a little bit more on different coalitions that you have experienced or how districts could develop them on their own.
Yeah. So Connecticut actually has a prevention infrastructure that's really been, many other states have tried to copy what they're seeing happening here in Connecticut. We have, and we've just had some restructuring within the prevention infrastructure, but we have 5 regional organizations that combine both behavioral mental health issues with substance abuse prevention. And those 5 regional organizations also support local initiatives called local prevention councils. And so the STEPS Coalition, very active coalition in Southington, but there are similar coalitions all across the state. And many of them are working or interested in working more with, some of them are very involved in school districts already, but others would love to get more involved. Sometimes they're pretty small organizations, and some of their more rural communities, they're pretty small organizations, but many of them, even in some of the smaller suburban areas or even in some of the rural areas, they're actually very active. They have sometimes outside funding, not only from the state, but from the federal government for drug prevention efforts, those kinds of things. But one of the things that's a real overlap between some of the community coalitions that exist across the state and the work you're doing in your schools is around the school climate initiatives. Some of the trainings that you've all gone to over the years, one of the things I was telling coalition folks, because I work with many of them, several years ago, well, more than even several years ago, was you need to attend these school climate trainings with your school staff, because the work they're doing around school climate is very similar to the work that you've been doing to mobilize and create some grassroots community efforts and kind of change how we look at behavioral health and drug prevention issues in the community, very similar to what's going on with these school climate efforts that you've been focused on. So it's really about kind of creating some change, some more systems or community level change as opposed to just the individual stuff. So that's an area of a real overlap between you and your community coalition efforts. So if you're interested, my email was at the beginning of this PowerPoint. You could feel free to email me if you want to find out anything more about a community coalition in your community. I can direct you, or even if they're not very active, I can give you that information as well.
Any questions or comments at this point from the information that's been shared?
Probably this is a good time for me to just add that the way Bridgeport implemented this student support page in Bridgeport is different than what New Britain did. And of course, I couldn't get New Britain folks in here because they're doing a different presentation in one of the other rooms right now. But they actually, they have a student support page very similar to what Bridgeport has. But one of the things that they also wanted to do is collect more classroom level behavioral health issues and stuff. So they've also created a system that they're using a lot more than they're using the student support page. They've created a system where teachers are inputting data in as far as any kind of behavioral issues or referrals, back to the office or, those kinds of things. And so there's a lot of different ways that this kind of information is being collected and being used. And so I think, again, Connecticut is not the land of one size fits all, and that's okay. So the idea is, how do you think you might use this in your district? And again, the Data Innovation Committee will continue to meet for few more months. And if you have any thoughts or questions, I can certainly be your access point back to the data committee. If you have questions or comments or ideas about how you might use this and need any kind of feedback or support, we'd be happy to help. Any other questions or comments, input, thoughts? Yes.
I have a thought. I don't work for a school district. My wife does, and she's been there quite a while. But the issue I think she and her fellow teachers have are the parents. And Nekita, you mentioned the parents want this for your child. Many times she hears the parents believe, no, there's nothing wrong with my child, or they're in denial. There is something that's wrong. So how do you grab that issue? And the other situation, I think, could both ways could boil down to insurance. If the parents have private insurance, and especially with these health spending, health saving accounts, that's cash out of your pocket first. They may not want to spend it on a child for that, especially if they think, she'll grow out of this, or he'll be okay. I think that's where we see the other side of the issue. And one more with insurance, I'm sorry. I'm surprised those with Medicaid type of insurance, if Medicaid is paid for, do they want to see the progress? Or do they actually go to the visit? What happens to the visit? So there's some of that managed care also involved that I think everyone should be aware of too. So sorry, there's 3 issues.
Yeah, there's 3 issues. Do you remember what the first one is? The first piece was, what was the first piece that you? Oh, the denial. So I think what I think is a nice objective way, it's not subjective, because a lot of times when you present things to parents, I think it's important for you to give them data, right? So if you're actually collecting the data, you can say, Susie Jones, we love her. She's seen the provider 20 times in the last month. On a typical week, she's coming into the office 7 times a week. We need to be able to do something about it. So I just think that, arming yourself with more data to give to parents, because sometimes parents are, it's uncomfortable to broach that conversation that something may be not so okay with their child. And it might be because of things that might be going on in the home, lots of different variables. And so I think it's an objective way to say, we've collected this data, just like an academic. If your child had academic concerns, you don't just say, we think that your son is struggling. We say, you know what, the tests demonstrate X, Y, Z. So you have that data. Your second piece was? Insurance. Mm-hmm. Yeah. Yeah, so in Bridgeport, we do have varying degrees of salary and income. What we do have, which kind of separates us from most districts, is we have school-based health centers in our schools. And so that's another tool for us to do referrals right in-house. And to be honest with you, our clinicians, they're so overstretched. We want to refer out, especially on those higher cases, but certain things we manage in our buildings, stuff that we probably should refer more out. So, because we do know we have to work with parents that may not be at that level to act upon a community resource. So you kind of have to be where the parent is in terms of that. Okay.
Let me follow up with that. One of the exciting things that happened as a result of the Safe Schools Healthy Students project is that New Britain started experimenting. They had some school-based health centers in some of their schools. And so as Nekita was saying, that really worked well, but they didn't have school-based health centers in all of their schools. What they did in some of those schools is they actually brought in a private provider who was able to, because of their licensure and everything, was able to do third-party billing. So at no cost to the school district, additional services were able to be provided to students in those schools. So that was a really exciting piece. And I think for me, especially in terms of this whole insurance issue that you're bringing up, I think this is a direction that we should really be moving. And I think that New Britain example really should be exposed. And I know the New Britain folks are really happy to talk to people. So Feel free to want to contact. I know Ryan Morgan, whose name is in the brochure a little bit. She's been part of a couple of different workshops here. Would be a point person to talk to there in New Britain for how that happened. And Klingberg is the organization that they brought into their schools. And I think actually Wheeler Clinic came into some of their schools as well. So a couple of different organizations with models for how that third-party billing went down. That's I think, something that's really cool that came out of this project.
Not only in regards to the billing, but also in regards to supporting the students in their natural setting, right? In the setting that where they're building the relationships with their peers, with their adults, I think is also an asset to that approach. So we thank you for your participation. So you'll see here that there is an evaluation at the Connecticut Safe Schools site that we'd like to be sure that you give us your feedback on. All of the partners that collaborated for this conference today, thank you for your interest, and we hope to continue in giving you resources. So as you are completing your evaluation, it's not only about your feedback on the particular day of the conference itself, but letting us know what your other needs are so that we could be a resource for you. So thank you very much on behalf of John and Nekita and myself. We hope you enjoy your afternoon. It's pretty sunny out there. So.